It is Thursday morning at 8:14, and that is the time that we welcome in our friend, Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health, to talk about senior health, not only if you are a senior, but maybe you're the son or daughter with a senior parent, and you're very concerned about their health. Good morning, Dr. B. How are you?
Hey, Tommy, I'm doing great. A little chilly this morning.
Yeah, I like it like this, though. Do you like the cool, or you prefer it warm?
I prefer it a little warmer.
That's what makes it a life, huh? January Glaucoma Awareness Month, an eye disease that affects millions of people who may not even know they have it. So, Dr. B from People's Health, tell us about the disease and how to take care of it. First of all, I guess, what is glaucoma?
Sure. So glaucoma is a very common condition, and really what it is it's a buildup of the fluid in your eye, which actually increases the pressure inside your eye. And that pressure can cause damage to the optic nerve. And the optic nerve actually runs directly from your eye to your brain. It's what processes vision and light that you see and kind of forms it into an image that your brain recognizes. So, the problem with glaucoma is most people aren't even aware that they have it, especially in the early stages, until they start having some vision damage. In fact, about 3 million Americans are affected by glaucoma each year, and about half of those don't even know that they have it.
And all the time, it's getting worse, and they don't even know they have it.
Yeah, because the symptoms are so subtle that a lot of times people can go quite a few years without really realizing it.
Wow. What causes it?
So like I said, it's this increased pressure in the eye. We call that the intraocular pressure, or IOP. And what happens is if the fluid in your eye can't drain, it normally recycles back and forth. But just like your sink, if it gets clogged up, then the pressure builds up in your eye. That causes pressure on the optic nerve. And it can be caused by a couple of different conditions, like inflammation in the eye or an injury. Sometimes medications that you've taken, like long-term steroids, can cause an increased pressure as well. But other causes are really not known. It just happens, and you have to monitor for it so that you can identify it and treat it.
So what are some of the things, signs or symptoms maybe, that you can look out for so you're not getting more and more damaged?
Yeah, I mean, like I said, the unfortunate thing is most of the time people don't have any symptoms until they start to lose their vision. So that's why it's important to make sure you see your eye doctor regularly. And but what happens actually usually with the damage to the optic nerve, people start to get blind spots. And they can be extremely subtle because they tend to occur on the peripheral vision, or the vision from the side of your eyes. So if you're looking straight ahead, you may not experience anything, but you may have difficulty seeing things coming at you from the side. So sometimes people will, describe bumping into things because they don't see them coming at them. And so that's really what your doctor has to identify and look for. Some other really common symptoms that we see are blurry vision. You can actually get what we call a halo effect, which is when a lot of times when you're looking at a light or you're driving at night, you'll see a halo around other lights that are coming at you. They may even look like a rainbow of colors around that light. And then some people have problems focusing, especially while they're reading or, looking at their phones or tablets. I already mentioned that peripheral vision loss is real common. And then some people get headaches because if it affects you a little different in one eye than the other, you try to accommodate, and that can cause some headaches as well. The one thing to keep in mind is usually glaucoma does not cause pain in the eye. In fact, if you get sudden onset severe pain in the eye, especially associated with blurry vision or nausea and vomiting, or if you have just sudden loss of your sight, that's a medical emergency, and so you have to seek treatment for that immediately.
But it can exist. It exists without pain, so that's why you gotta have an annual eye exam.
Yeah, and really most often it's completely painless. The vision loss, like I said, is very subtle, and so you may not pick it up right away, so that's why it's really important to see your eye doctor.
Who's at risk for it? Does it affect different people different ways?
Well, anyone is at risk for glaucoma, really, but there are a couple of groups that we monitor a little more closely and maybe a little bit earlier. So, race does come into play. African Americans and Mexican Americans actually have a higher risk of developing glaucoma. It does come with age, so anyone who's over 60, anyone in our senior population definitely should be getting screened regularly for it. It also runs in families, and so if you've had parents or a brother and sister who've had glaucoma, you definitely should be aware of that and watch out for it. Like I mentioned, it's related to high pressure in the eye, so you can develop an elevated pressure in your eye that's not actually glaucoma yet, but if you do have that high pressure, then you need to get screened real often for it. And then one disease condition that we see a lot of in Louisiana is diabetes. People with diabetes are definitely more likely to develop glaucoma and need to be screened much more often than the general population. If you don't have any of those risk factors, usually getting screened every couple of years is adequate.
All right, we'll take a break, talk about diagnosis when we come back. Dr. B, our friend Dr. Brent Wallis, Chief Medical Officer of People's Health, talking about senior health as we do every Thursday morning. And today we're talking about glaucoma. It's 8:20, time for traffic, WWL. Tommy Tucker, WWL, Thursday morning, 8:24. That's when we talk about senior health. With Dr. B, Dr. Brent Wallis, Chief Medical Officer of People's Health. Today we're talking about glaucoma and how badly it can affect your vision. And now we're up to, I guess, talking about how it's diagnosed. How do doctors diagnose a patient with glaucoma?
Well, so fortunately, it's pretty easy to diagnose, and that's why you need to go to an eye doctor, though. What your eye doctor will do is they'll obtain a complete medical history, talk to you about your family history and any other medical diseases that you have, and then they'll do an eye exam. And that eye exam includes a couple of different things: visual acuity, which people are probably used to doing. That's the eye chart, where you have to read the lines so they can determine, how your vision actually is. A lot of times they'll also do something called a pupil dilation test. And what they do there is they put some drops in your eyes, and it widens your pupil so they can get a really good view into the back of your eye. It's kind of neat, actually, that the eye is one of the only areas where you can look directly into what's going on in your body, in the nervous system, straight through that pupil, and that gives them a lot of different information. They'll also do a visual field test. Like I mentioned, peripheral vision loss or loss of vision on the sides is very common. So they've got ways that they can actually measure that and assign a number to it as well. And then they have a tool that's called a tonometer, and it looks kind of like a big pin, and they use that to press on your eyeball and actually determine what the pressure is. And if they see that increased pressure that can cause glaucoma and the vision loss, then they can treat that.
I've had that done. Just to be clear, Dr. B said pen, not pin.
Exactly.
Big difference. If you are diagnosed with glaucoma, what are some of the treatment options?
Well, we do have a lot of treatment options for it, which is also very fortunate. Most often we use eye drops, or sometimes oral medications, and the eye drops are usually either once or twice a day. Excuse me. We can also do laser treatments, and the laser treatments are designed to reduce the pressure in the eye and stop the damage from occurring. Sometimes, though, if that doesn't work, we have to move on to a more conventional surgery where they can actually make a new opening in the eye in order to allow that fluid to drain out more effectively and reduce the pressure. And then sometimes along with that surgery, they may have to put a little tube or a shunt in your eye, which is a tiny device made of steel that's implanted in the eye to create an artificial pathway to let the fluid drain out. The one thing for people to keep in mind is that, the surgical procedures are not kind of one and done. A lot of times they can help stop the progress of glaucoma, but they have to be repeated. And so what's really important if you're being treated for glaucoma is make sure you take your medicines like the doctor says, because this is not something that you take a pill for it and it goes away. This is a chronic medical problem that you're going to have to take those medicines every day after you get the diagnosis. And then it's really important to also make sure you tell your doctor about any side effects that you get from the medicines, or if you're having any increased vision loss, or if you're having trouble doing your daily activities, if you can't read signs on the road, if you can't read books and stuff like that. That's really important to let your doctor know, so that they know maybe the medicines that they're using or the procedures they've done have not worked and they need to make some adjustments. And, like I mentioned, this runs in families. And so if you get diagnosed with glaucoma, it's real important to let your family know so that they can go get checked as well. The unfortunate thing is glaucoma really does not have a cure. And once you start having that vision loss, you can't get it back. So early detection is really the key in preventing the vision loss from glaucoma.
Any way to prevent it?
Yeah, you really can't prevent it. Really, the best way to prevent the vision loss itself is early detection. And like I said, that's why it's so important to have regular eye exams to see if maybe you do have it. And really, your eye doctor is the only one who can determine that pressure in your eye. So you can talk to your primary care physician about any vision problems, and you certainly should, but ultimately you're going to have to see an eye doctor in order to be diagnosed. I think if you have a disease like diabetes that has a much higher incidence of glaucoma, you really need to work on keeping your diabetes under control, keep your sugars in check, because that'll help prevent future complications. The eye exams are very important. In general, if you're not in a high-risk group, making sure you have one of those dilated eye exams by the age of 40 is a good way to start, and then your eye doctor will let you know how often you need to get checked after that. And then really, Tommy, we say this all the time, the other things that always help every disease is make sure you're exercising, keeping your weight down, in particular with glaucoma, controlling your blood pressure and being physically active and avoiding smoking can help prevent any complications from this.
Very valuable information. Thank you, Dr. B. I hope you have a great weekend. We'll talk to you next Thursday.
Thanks, Tommy. Talk to you then.
You bet. You can find out more at peopleshealth.com. You can call 866-687-7335. And you can follow People's Health on Facebook, Twitter, and Instagram. Time now, WWL.